Hi everyone. This is Dave. As promised, I told you that I would give you a little more of an overview of some material in the course. This is not going to test you on chapter 16, but I think it's really important to have more of a sense of the types of psychological treatment that are available to folks who have some type of mental illness. And I think this could also be helpful for you too in preparing for your course research project as well, because I do ask in that in in the instructions for you to think more about, well, what are the types of treatment that might be available. So I think this could be helpful for you for a range of reasons. But again, this will not be a part of one of the chapter 16. It will not be a part of one of the exams. So let's get into this a little bit. It's titled Psychological Treatment, which I think is pretty straightforward. Here are some things I want you to think about. So anyone who is entering therapy, right, it's important, I think, for them to first have the goal of wanting to make change in some way. But it's also very important for the therapist or the counselor, whoever's providing the treatment, the psychiatrist, etc., who, in this case, therapist, that the therapist also holds the premise and the belief that psychological problems can be addressed in a way that's healthy and that it can lead to change. My long drawn out story is, obviously it's important that therapists approach therapy with that belief that the treatment can and their efforts can lead potentially to change for the person who's seeking the treatment. But it's also important for the person who's seeking the treatment to also hold at least the hope that there could be a positive outcome, that things could improve by seeking therapy. A lot of reasons why people seek therapy. For some folks, it is due to a current stressful life situation. That could be maybe a pending divorce, job loss, significant or acute health issues. It could be any number of reasons why people will seek therapy. And the understanding there is that depending on what the current life stressor is, that when that stressor is resolved, when it passes, that the person has gotten the support they've needed throughout, and that whatever they're experiencing as a result of that stressor, like say depression or something else, that will be relieved. And when the stressor is gone, so will those most of those feelings and symptoms, so that they'll return to normal. They'll be themselves again. Other folks are seeking therapy because it's it's a longer standing issue. That could be someone who's been maybe struggling with, say, an eating disorder for many years and have not sought treatment for it, or someone who's had maybe periods of depressive episodes throughout their life and have not, for whatever reason, have not received treatment for that. And whatever they've tried may not have had the full benefit, or they may not have really benefited from whatever they were trying. For example, maybe some folks will try, I know, not psychotropic medications, for example. They'll seek some holistic treatments, and for some folks, holistic treatments might work, but they don't work for everyone. And then finally, there are folks too that are in therapy because someone told them they need to go, like a partner or a spouse, like, I think you need to get some help. But it also could be due to court involvement, any number of reasons. And also, some people are actually doing fairly well, but they still may seek therapy, maybe in terms to help with some issues or some things where they're seeking some personal growth as well. So a lot of different reasons why people pursue therapy. There's a lot of people that do provide therapy, and I'll talk in a moment about therapists, counselors, clinicians. But there are also folks that don't necessarily provide therapy directly, but they're trained and they're able to recognize instances where someone might benefit from it. So that would include physicians, for example, and in that I would include nurse practitioners, nurses, for example, folks that, I mean, they're talking with you. They hopefully, if you've seen them long enough, they know you, and they understand more of your history, and they may also notice changes. And the same would be for clergy, a rabbi, a minister. They're the folks that may actually suggest that you seek therapy or some type of counseling too. And again, ministers, for example, are not trained to provide mental health counseling, but they are trained to do pastoral counseling. And a part of their training to be able to do pastoral counseling is also training them in how to recognize when people might need more than pastoral counseling. So again, something to keep in mind. As you see here, there's a lot of different, you have a lot of different clergy, physicians, but who are the people that may refer or suggest that someone seek treatment, but who are these people that they're going to? So it could be counselors, therapists, for example. I list here psychiatric social workers. There's a difference between someone who's working as a social worker in a non-clinical setting, let's say, versus someone who's got, like, say, they're like a licensed social worker. They have a mental health training background in addition to training around in social work. And then, of course, psychiatrist, clinical psychologist. And again, I would include in here, there are some, there are different types of counselors, and we'll get to those a little later. Really important, these are, I think, a lot of the really important key elements of what effective therapy can look like if there is a good working alliance between the client and the therapist. So a couple things to keep in mind here. I realize that I gotta move something. Oh, nope, couldn't do it. Sorry. A couple things to keep in mind is one, both really important for the client and the therapist to hold that there's a sense that they're working together, that their collaboration on the problem will help the client to really be able to move toward addressing whatever it is they're seeking help with, that they will work together collaboratively toward a goal. And that's really the task of the therapy, is helping the person who's seeking the therapy to move toward a goal of some type. For one person, it might be they want to have fewer depressive episodes, or they want to have a better relationship with a spouse or a family member, or it could be any number of things. And then finally, there has to, as I said, there has to be this agreement. So those are a couple of key elements, I think, in how that therapeutic relationship hopefully is established, and the foundation for it too. There are some other things to consider what can help to enhance therapy. One is, what are the client's expectations around what they're going to receive? So I think it's important when you are seeking a therapist, for example. One is, it's always good to try to do some research in advance. I don't know if you're aware, but you can go to Psychology Today. You just type in Psychology Today, and if you typed in seeking therapist or seeking mental health counseling, you can read the bios of therapists in your area, and you can get a sense of who they are just by reading their bio. So that alone can give you a sense of who they are and what type of treatment they might be trained to provide. Also a matter of the person's motivation to change. And again, you can imagine that someone who's experiencing a mental health issue that has just occurred is probably highly motivated to change, because they want to go back to normal. They want to feel more like themselves, versus someone who's been told you need to go to therapy. A family someone telling a 16-year-old, you're going to have to go, we think you need therapy. Parents telling the kid or the young adult, you need therapy. They're less likely to be motivated to want to participate. Also, a protected setting is very important. So again, that I think is mainly boils down to a place where the person feels like their confidentiality can be protected, their privacy, and they understand really the limits of confidentiality as well, etc. So there's a lot that I think goes into that therapeutic relationship. These are some other things just to think about, which I think is interesting, is how does the therapist, for example, understand or view change? How do they recognize it? What information when the person's in treatment? How are the reports or the information from family or friends of the person that's seeking treatment, how might that be incorporated? Also, it's interesting too that there are some ways to assess another way to assess how successful therapy is. You can do kind of pre-test, post-test. What does that mean? You could have someone do, for example, some personality tests right before they begin therapy, and then do the same test after they've completed the therapy, and hopefully there's a change in the scores. And if there are a change in the scores, quantitatively, data-wise, that would show that there has been a benefit to the treatment because the scores that the testing generated have changed, hopefully have changed for the better. So again, these are different ways to really get a sense of if therapy is actually working for someone. The fly in the ointment is there are some therapists, and people have all different skill levels, and there are some very good therapists, and there are some that aren't the greatest either, for different reasons. Unfortunately, some therapists might not be as skilled in recognizing also when someone is perhaps decompensating. So that's also a thing that therapists have to really be well trained around and aware of. Couple quick things for you. So these are, for example, referencing other quantitative methods to determine if, first of all, what the therapist and the person might be looking at in terms of the severity of, say, depression. So the Beck Depression Inventory is, just like it sounds, it's an inventory, it's a questionnaire. In this case, the client fills this out, and then they review it with the therapist. And it does generate a score, and the scores are based on really a mild, moderate, and severe in terms of the symptoms that person is reporting that they're experiencing around depression. The Hamilton depression, but the problem with that is sometimes it could be the questions might, if the person doesn't understand the questions enough, or they, as we know, sometimes folks filling out surveys that their responses are sometimes motivated by different things. So they, in other words, someone filling out one of these inventories, it might not always be the most accurate, but at least it's a starting place. The Hamilton Depression Inventory, on the other hand, that the clinician really completes that, and then they talk about the results with the person after. And then there are MRIs too. I know this is really well beyond a questionnaire, but magnetic resonance imaging, for example, can show if there are parts of the brain that are not, if perhaps there was brain damage at some point, or there's been a change in the way that, in the actual, how different parts of the brain actually function. There are folks that would do, not therapists, but these MRIs could be beneficial if the person has had one done to really get a sense of what the results were from that MRI. Again, research, a lot of research is done to really also advance the quality of therapy, and that's really ongoing. But there even as much research as is done, there are instances, for example, that really can't pinpoint, for example, why some folks who do enter therapy don't improve, actually. And there's a number of factors, but they can't really determine all of the factors why therapy might not always be successful for someone. But the majority of people who do enter therapy generally will see an improvement, that the therapy could actually help to accelerate recovery. And there's, as I said, a lot of research done, around these things. I will put this out there too. There are also there's some therapies. I would invite you to take a look at the text. It does talk about it's I think the section is called when therapy harms. Take a look at that in the textbook. There are some types of therapy that are actually harmful. One of them is called conversion therapy. Conversion therapy, I don't know if you're aware of this, is illegal in Massachusetts. Therapists cannot provide this type of therapy. Conversion therapy was designed to try to convert people who are LGBTQ plus, for example, to try to convert them back to being heterosexual. And the therapy is not based on research. It's really dubious in terms of its what it claims as, what's successful and whatnot. And it has actually been shown to actually do more harm to people than anything else. And it's actually illegal in many states. Therapists that unfortunately are not following ethical guidelines and codes. There are some therapists that unfortunately do cross boundaries, and if they have a relationship with a client, that can be very harmful to a client. So that is forbidden in the field, but it does unfortunately happen. There are also some folks that, regardless of how good the therapy might be or how good the therapists themselves are and what they do, that some folks do also deteriorate during therapy for a range of reasons. So it's certainly not perfect, but in general, there does appear to be improvement for people. I'll go into a couple more slides here, and then I'll wrap up this part, and I'll do a second for you. So there's a lot of therapy. There's a lot of research out there, rather, that talks about, well, how is it more beneficial for people to just do therapy, or is it beneficial for them to just do medication, or well, what if they do both? And there's been a lot of research done around this. I'll say, for example, let's just take the benefits of medication. So there are studies done, and they're controlled studies, and by that I mean that the research is using the experimental methods that we talked about in Chapter 1. For example, if they want to see if a particular medication that's maybe not yet on the market is going to be beneficial to treat anxiety, they will bring people into this clinical trial, and some people will receive the quote experimental medication. And of course, people are told in advance you'll be receiving an experimental medication. And they're told about both what could be the potential benefit and also some negative, aspects of participating in the study. But some folks who are in the study will receive this experimental medication. Other people don't. They receive something else. It's not that medication, like a placebo. And that can help the researchers to determine if there was a change in that person's, say, level of anxiety by taking that medication, if in fact they were one of the people that received that experimental medication. And then there's obviously been a lot of research done about different types of therapies as well. So that's the question that I think a lot of people have is it better for me to just do therapy? Is it better for me to just do medication, or none of the above? Or should I do both? So that's really important, and I will talk about that a little more in the next video. Hope you're enjoying this.